Hi, Kevin Henry, the Group Editorial Director for Advanced Star and Dental Products Report, and I'm on a Google Hangout today with my friend Robin Morrison. Robin, how are you?
Doing great today. Thanks, Kevin. How
Good.
are you?
I'm great. Thanks for asking. I get to talk to you, so life's good. Hey. Um, Robin is the Vice President of Oral Cancer Cause, which is a great group that hasn't gotten a ton of publicity yet, and that's one of the reasons why we're doing this Hangout today. So, Robin, I would love for you to kind of explain to our viewers what Oral Cancer Cause is and really why it was started.
Sure, I'd be happy to. Okay, so Oral Cancer Cause was founded by Linda Miles and myself for the reason that we have so many years together in dentistry, about 85 years combined, and the fact that I lost my brother to oral cancer and she lost her sister-in-law to oral cancer within a few months of each other. And so that brought us close together, and we just felt like we had a mission to help educate the public, help educate the dental community, the practices, on the steps that should be taken to prevent it getting to such a devastating stage. Because treated early, obviously, the statistics show. I mean, the survival rates are so much better. If you're diagnosed stage 4, I mean, your survival chance is, really doesn't go beyond 5 years. So, and there's no reason for it to go that far. So we decided that what we wanted to do with our funds was twofold. We want to help create the education that needs to be out there, and then also to help the families that are affected by this debilitating cancer, the surgeries, the treatments, the fact that many of these patients, when it gets to the final stage, they lose their ability to speak, swallow, they lose their ability to really earn an income. So a lot of the families are devastated financially. And so we have chosen to have our funds go to help those families that are in need after enduring, these trying times.
And that's really a side of things that I thought whenever you and Linda created this was so cool because we focus on the victim as well. We should, but also it's not just him or her that's affected. It's his or her entire family, and I think it's great that you all help out with that.
It does. The caregivers are so affected as well, and it's like we want the patient and the family to focus on the recovery and getting stronger and getting well, and not have the stress of the financial situation that they're faced with, to ease it as much as we can.
Robin, oral cancer has been in the news a lot lately with the battle that Jim Kelly is fighting, the former Buffalo Bills quarterback, and the recent passing of San Diego Padres superstar Tony Gwynn. Whenever you hear things about like this, and you really see it pushed out in the mainstream, what do you, from the oral cancer cause perspective, what do you hope that does for dental professionals out there?
Well, we really hate to see anybody affected by the disease, but it definitely opens eyes when it's somebody that's more of a celebrity or in the public face. But hopefully, by them seeing, actually people, the celebrities, so to speak, affected by it, it does create the awareness. And unfortunately, sometimes it takes that to make it happen. But then once that door opens, then we want to take that opportunity to step in and really provide these practices what they need to be able to do the oral cancer screenings thoroughly, properly, their team. And it's okay for the dentist to come forward and say, we're not quite sure if we're doing it exactly how it should be done. Should we be including a device, or should our hygienist be doing it? Should we be doing it? What's the frequency? And so we've created an incredible group to help support and create this educational material, not only for the dental practices and the dental professionals, but also for them to provide to their patients and what they need to be telling their patients and educating their patients. So it's opened that door, and in the dental practices and dental community is definitely paying more attention.
And like you were saying a minute ago, a lot of times dental practices just don't have the way to explain it to patients or the way to kind of start that conversation. And again, that's one of the things that I think is so great about Oral Cancer Cause.
Right, and the practices that we work with, we are there to support them. So we are providing scripting for them from the first phone call that comes in for a new patient. I mean, we have them talking about oral cancer on the first call, and that you're going to get a thorough, advanced oral cancer screening in our practice. And then how does the hygienist present it? How does the assistant take advantage of the time when they have the patient in the back office, just the two of them waiting for anesthesia or whatever it might be, to take advantage of that opportunity and educate those patients? Well, they have that time, and so you know, to be able to provide that to these practices is really it's making a difference, and we're seeing the difference.
And how do practices get involved with Oral Cancer Cause?
Well, they can become involved in several ways. We have some practices that like to do events, and we just wrapped up April as the Oral Cancer Awareness Month, and we had some really exciting events that took place for that. They can also become a donor, and we have several different levels that they can get involved. They can go to our website, which is oralcancercause.org, and there's a link, Become an OCC Practice, and there's a full explanation of how they can get involved and what we can do to assist them by providing the patient education brochures, the posters, articles for their website. We provide a press release for them to send out to their community so that the community is aware of the type of practice that they have and that they are doing the thorough oral cancer screenings. And when they come into the practice and get their oral cancer screening, they leave with a sticker that says "Got Mine," and they go back out into the community. So their patients become, you know, educators also. So they're out there telling their coworkers or people they see in their daily routine about oral cancer and also about the practice they visited. So we didn't design all that to be marketing material, so to speak, for the practice, but it's turned into that. So they become the go-to practice when you really care about your overall wellness.
That's awesome, Robin. And would you mind just giving our viewers the website one more time where they can get more information?
Sure. It's oralcancercause.org, and there's a wealth of information on there. There's patient stories, there's videos, information for professionals, and information for patients. It's a great resource.
Well, Robin, thanks so much to you and Linda for starting this and really bringing that passion forward. Thanks so much for your time today as well.
Oh, thank you, Kevin. We really appreciate it, and we appreciate that you're helping us get the word out.
Absolutely. Talk to you soon. Thanks.
Thank you.